Now, new research shows that people who survive a stroke are at an increased risk of developing major heart issues in the month following a stroke, which then puts them at a greater risk of heart attack or a second stroke within the next 5 years. These cardiovascular complications following a stroke are known as stroke heart syndrome. Joining me now to talk about this, Dr. Shala Mulukutla, pediatric and adult interventional cardiologist at Las Palmas Medical Center. Dr. Mulukutla, always a pleasure to have you on the show. First of all, what types of heart problems are associated with stroke heart syndrome?
Yeah, so stroke heart syndrome is interesting. This study looked at 300,000 patients over 20 years and found that people that had a stroke were at an increased risk of having a cardiac event in the next 4 weeks after their event, and another stroke within 5 years, as you said. And I think part of it is because the risk factors that affect you to have a stroke are very similar about the risk factors that happen to be cardiac disease. So high cholesterol, diabetes, blood pressure, these are all things that can cause a stroke. And if you have a blockage in your heart artery, you may have a blockage in your brain artery. And these ischemic strokes, in 87% of these patients, these are patients that had blocked arteries there. So it's very possible that you could have some of the same things happen in your heart.
So are these stroke patients more likely to have another stroke?
They are. And in the study, they showed that they were more likely to have a second stroke up to 5 years afterwards. And part of the reason was some of patients have atrial fibrillation, which is a funny heart rhythm that we see in up to 10% of the patients that have a stroke. But what was also interesting is 12% of the patients actually presented with acute coronary syndrome in the next 4 weeks, which is chest pain. So it's very interesting that they're sort of like we say, birds of a feather flock together. They're sort of bad things that are together. And in this case, it just means that we just have to be more vigilant when we're taking care of stroke patients because there may be cardiac problems as well.
So what can someone do to manage their heart health to make sure that they don't have a second stroke?
Yeah, so the key is prevention. And the key also now is what we think is good communication between the brain and heart doctors and, of course, the general doctors, and decreasing your diabetes, so your hemoglobin A1C if you have it, decreasing your cholesterol, and managing your blood pressure. So managing your risks along with diet and exercise are going to help decrease your risk here. It's not going to make it zero, but it's going to decrease it so the chances are less. And that's our goal with all patients, to decrease their overall risk.
Cardiologist Dr. Shala Mulukutla with Las Palmas Medical Center, thank you so much for coming on this afternoon.
Pleasure to be here.